Okay, you're live.
Thank you very much for that, Lee. Good evening, everyone. Just to remind you, we are being live streamed, and we've really got one substantive item on the agenda this evening, so we'll kick straight off. Are there any apologies and substitutions, Lee?
Chairman, you have apologies from Jenny Wood and Lizzie Edwards.
Thank you. Are there any declarations of interest? No, good. Any questions and deputations?
None received.
Okay, so let's move straight on to item 4 then, the Adult Care and Support Performance Progress Quarter 3, 2021-22, pages 5 to 14. So over to you, Alison and Bethany.
Thank you, Councillor DeSico. So I'm bringing the usual performance report for Quarter 3, 2021-22, on behalf of Lizzie Edwards, Assistant Director. So just to put a bit of context around it, obviously adult care and support performance is measured in line with the Department of Health and Social Care ASCOF framework, and ASCOF performance information is reported nationally on an annual basis. So performance is ranked into 4 different quartiles against other local authorities, these being top, upper middle, lower middle and bottom, and the report provides our national performance in each of the ASCOF areas. So if it's okay, I'll presume that members have read the report and I'll just pull out a few select points. So you'll have noted that there are some areas of success to highlight. These include measures relating to self-directed support and reablement. There are still challenges that we're kind of impacted on our care home placement admissions, very much around changes to hospital discharge guidance. This is also impacting our direct payment indicators. And I do understand that this has been previously discussed with you, but obviously I'm happy to take questions at the end if you've got any. In terms of our LD employment, we are projecting significant improvements in the next financial year. Very much with the council directly employing individuals with learning disabilities and also with our work with employers in the borough. You'll have also noticed in the report that there is an early warning of upcoming changes to the ASCOF report. So the Directorate Leadership Team usually agree targets for the next reporting year in February. These are usually based on the previous performance outturn and also local factors. But for 2022-23, rather than locally agreed targets, the Directorate Leadership Team has agreed to benchmark performance against the highest national quartile. This will ensure that we're really aspiring towards excellent performance. And this change will be reflected in the Cabinet Portfolio Holder Report from Quarter 1 for 2022-23. That's a very brief and succinct outline really of the report, but I'm very happy to take any questions. And I think we might have just lost Councillor DeSico for a moment.
I think we have. I wonder if anybody thinks we should pause and wait for Councillor DeSico, Lee, until we can get him back on.
Yeah, he's just put his microphone onto mute. But yeah, we'll just give him a moment or two. He's back with us now.
Yeah, I lost you there for a little bit. I don't know what happened. It was a little bit. You know, I think I got one word in every 5 there, Bethany, towards the end of your sort of your presentation. But I think I've got the overall gist. And before I open up to questions from the other sort of members, just basically 1 or 2 questions and also some comments. I think it's the right thing to do to benchmark against the national picture, because that gives us a good idea of how we are performing. I think a truer reflection of how we're performing, so that's good. I think with all these performance targets, sometimes you're only as good as the target you set in the first place. So some of the targets you can set and they can be a little bit, you know, kind of not quite right or unrealistic, or given circumstances that occur during the year, like, you know, kind of the pandemic and lockdown, things can change, which you didn't anticipate at the beginning of the year when you set the targets. So we always need to bear those in mind. And for me, absolute performance is important, but where there are issues that you may be falling behind for any particular reason, it's always important to have a plan in place to actually to make sure you can remedy the situation in good time. And I think we've done that certainly with the area of learning difficulties.
I think we've lost him again. Should we just pause for a moment?
Seems to be dropping in and out. I seem to be dropping in and out here for some reason. I'm not quite sure why. Can you hear me now?
Yeah.
Yeah. I'm not quite sure why my iPad keeps going down. I was talking about the percentage of people who use services and receive self-directed support. The performance for 2020, 2021, we had the outturn for quarter three was 99.8%. But in 2021, we were lower middle quartile. So what was that performance in 2021? Where have we gone from to where we are now? Where were we performing previously?
So just to clarify, Councillor DeSico, is this in relation to the self-directed support?
It is, yeah.
Indicator? Yeah. So this one is very much measured around we collate the data from our systems. So actually we've made improvements to our data collection within systems, which has really helped to kind of drive our performance in that area. So that would be why you're seeing an improved performance figure for this reporting period.
Thanks very much. Can you hear me? I keep going in and out for some reason. I don't know why. I'm going to open up to the floor anyway to Richard, Councillor Richard Long, and also Marcus Brain. So if they've got some questions, please.
Yeah, thank you. I mean, I find it helpful to see it represented graphically, but also for you to have put the numbers associated. So a percentage can be a bit meaningless if you don't know how many are in that cohort. I guess you've answered the question about how you measure the self-directed support. So that do people that try to access actually complete a survey, or is it just that once they've reached the end of their search, it's assessed whether they have achieved their objective?
So that's obtained when somebody at the end of somebody's Care Act assessment. So if they are actually provided with a care and support service, it's the way we record it on the system. So we draw that information from our Liquid Logic system. Right.
And the only other question I really had related to item F and the step change. But I think you've said that that's through a targeted piece of work. So it's really my question's just, are we expecting that to be sustained now? So it's not just a ramp up and then the risk of that dropping off again. That will continue to be held at that new level.
We are expecting it to be sustained. I guess some of the other things that we've introduced, I guess, across the directorate is our sort of improved performance improvement boards. So actually, you know, if we have early indication that we're underperforming in certain areas, we bring forward kind of performance improvement plans to address any kind of underperformance and sort of pull together contingencies so that we can make sure we're on track to meet targets. So yes, we have our performance improvement board, so we do expect performance to be sustained.
How often does that improvement board meet?
So they meet weekly. Karen might be able to give a little bit of an update because she's a regular attendee.
Yes, that's right. It's a weekly meeting, and partly we're aiming to be really as strong as we can by the time we have the CQC assurance regime introduced for adult care and support sometime in the next year. And partly it's just because we've got a directorate target of having high performing teams and delivering the very best that we can. So we're just building in that culture of constant challenge and awareness of if things are not as good as they could be. We're getting out of the worst trials of COVID, and we want to be really focusing on delivering consistent service improvement, consistently good service experience for people that we're providing support to.
Yeah, certainly I agree with the ambition to target a sort of higher national quartile. I think it certainly helps support that focus on continual improvement. No, that's all I had. It's overall it looks a good picture, and as you say, where there are areas requiring improvement, can see that there are plans and progress in place.
Any questions? Carry on.
Nope, lost him again.
Getting silly. So you could be works at the moment for me, I'm afraid. Karen, if you want to continue with the questions now.
No, you've gone all Norman Collier there.
Oh, okay. Can you hear me now?
Not really. Nope.
Can you hear me now, Councillor? No. Okay. Can you see me at all?
Councillor De Sico, just try with your camera off for the time being. See if that
Yeah,
helps.
good idea.
See if that helps.
Yeah.
See
Good
if we
idea.
can just get the audio with you.
Is it better? Can you hear me?
Yeah.
Okay. Councillor Brain, do you want to continue?
Yes, thank you. The data sets presumably are produced by, or a lot of them come through Liquid Logic. Given the fact that we've had quite a lot of issues with Liquid Logic, which were picked up by audit, are we entirely confident that the data that it's actually producing is accurate and a good representation of where we're actually at?
Yeah, if it's okay, I'll pass over to Alison to perhaps give a bit more of a detailed response to that.
Okay, thank you.
Well, I'm not the council expert on Liquid Logic, but obviously these figures we provide month to month and then quarter to quarter at this cabinet member meeting. But at the end of the year, there is a data cleansing operation that goes on just to go through all the data to check that whether it is 100% accurate. And there are often very tiny tweaks to each of the measures once we get end of year figures for sort of after March of each financial year, so that there is occasional tweaks to the measures, but I think they are kind of 98% there, so I don't think they would affect whether we're meeting targets or not, but there will be like the odd individual that needs to be put into the calculation who's been missed off for some reason.
Okay, because I'm aware that when Liquid Logic was first implemented, there was a lot of data that didn't go across and had to be manually entered. So there was a substantial problem with that. I know from talking to social workers and other people who actually use the system, there was a hell of a problem with it initially. Those problems aren't completely cured as of yet. And as I say, the audit committee actually had a separate report which was presented last week and actually identified many of the things that I've been saying for the best part of 2 years. So I just need to be confident that the data that we've got, obviously the usual IT phrase GIGO comes in here. So are we absolutely happy? And do we have checksums? Are there other ways of verifying the data so that we know that everything we've got there is entirely accurate as best as we can make it?
Yeah, well, as I say, there is that end of year data collection, data cleansing process to double check everything. But I mean, I think that's a query both Beth and I can take away and see if we can follow up on for you. That can be minuted.
Okay. I mean, I'm aware that I've certainly come across cases where things were not logged on the system properly. There were big gaps in the data, which actually had quite substantial impacts for end users. So I'm still very fidgety, and as I say, it was a bit disconcerting to find that all of those things I'd seen were actually borne out in the report. But if you can take that back, that would be very much appreciated.
Will. Thank you.
So is that all your questions then, Councillor Brain?
For the minute, yes. Thank
you. Yeah. Karen, so you've got your hand up.
Yes, Councillor Brains raised an issue about substantial gaps or inaccuracies in data. If you have any particular examples, we'd be pleased to follow those up and make sure that they are properly investigated. So if you could let us have details, that would be useful. Thank you.
Yeah, that's a good question, Karen. There, good observation. And for any of this reporting, you basically you're only as good as the data collection that you get to report the figures. And sometimes, I think it was one of the measures here where some of the data was missing, and we went from having a fairly average performance to being performing really well when we actually got all the data in. So I think that's a key aspect of any of this reporting, is how good we are at getting the data in the first place, and having kind of figures that are representative of actually what's happening. So the last thing we want to do is have figures which show that we're not performing well. Well, in reality, we are performing quite well. It's just there's an issue with the data. So I think that is something that obviously going forwards. You've already said that you're going to look at this. Is something we need to bear in mind whenever we look at these figures. But over all in all, the overall performance from the Directorate, I think, is very good, and that's reflected in these figures. And obviously, hopefully, we can take that into the next council year next year. I don't have any more issues or comments or questions. Does anybody else have anything extra they want to say before we close the meeting? No? Well, thanks very much. Thanks for bearing with me with my IT problems, and hopefully I'll see you all again soon. Have a good evening, and take care. Thank you.